Welcome to the Barrier Breakdown, Disrupting Mental Health podcast, where we talk about the clinical and practical issues that face those working in the mental health industry. Hello, everyone, and thank you for joining us for this week's episode of the Barrier Breakdown. My name is Erin Molyneux-Bailey. I'm the Chief Operating Officer at Cognitive Behavior Institute, and my co-host, Dr. Kevin Caridad, who is the CEO and owner at Cognitive Behavior Institute. This week, we are joined to discuss the topic of OCD with Nicole Gibson, who is a licensed professional counselor certified in cognitive behavioral therapy, exposure and response prevention, and telebehavioral counseling. Nicole specializes in the treatment of OCD and anxiety disorders at Cognitive Behavior Institute and offers individual and group counseling for clients diagnosed with OCD, as well as individual and group consultation for professionals interested in certification and exposure and response prevention for OCD. So Nicole, thank you so much for joining us. We've been wanting to have you on the Barrier Breakdown for some time now, so we're so excited that you are here today. So welcome.
Thank you. Thank you guys for having me.
Can we start off the conversation for our listeners today by sharing your personal kind of journey and interest in how you first became, interested in mental health?
Absolutely. Yeah. So, what comes to mind is I had two primary motivators for entering this field. As an adolescent, I personally experienced the benefit of therapy as I sought treatment through my parents' divorce. And so I felt that was helpful, and I desired to kind of help people in that same way. And then secondly, I had a lady that served as kind of a mentor in my life. It was a friend's mother who worked in the drug and alcohol field and was also my cheerleading coach. And so just watching her interactions with clients that she served and just hearing about her experiences, I just gained such a deep appreciation for her passion for helping others and unrelenting efforts to just really help those in need. So I think those two situations are what really solidified my desire to work in mental health as early as really a freshman in high school.
Wow. Well, that does not surprise me that you, as one of the most motivated and organized people that I know, knew that calling as early as ninth grade. So that does not surprise me at all. Talk to us a little bit about how you initially became interested in OCD. We know that that's a huge focus of your work currently.
Yeah. So when I started to work at CBI, I started meeting with clients who were clearly exhibiting symptoms of obsessive compulsive disorder. And prior to this time, I worked at an inpatient drug and alcohol facility. So I was far from an expert in this area and knew, very little, to be honest, about OCD and its treatment at that point in time. And I had always naturally gravitated to more cognitive behavioral therapy as my approach. And knowing that exposure and response prevention treatment is the best known course of treatment for OCD, I just really dove into reading books and literature online and working to understand as much as I could about OCD's presentation and its treatment. And so I think with my natural inclination for CBT therapy, and exposure and response prevention treatment being kind of very evidence-based, driven, I just felt like it was a natural fit for me. So before long, I think it was just something that I became extremely passionate about treating.
Great. And for some of our listeners who work with clients but may not specialize in OCD like you currently are, could you talk to us a little bit about a typical presentation for a client who may have OCD?
So as it states in the DSM that a client has to meet the criteria for either obsessions, compulsions, or both. And now most experts in the field would say that clients presenting with OCD have both obsessions and compulsions. So those obsessions are those kind of intrusive, persistent thoughts that cause some sort of anxiety symptoms. And as a result of those anxiety symptoms, they begin to engage in these compulsions as a way of decreasing the anxiety and to prevent feared outcomes from occurring. And so while these compulsions provide some temporary relief from anxiety, they are really what maintain the OCD symptoms over time. And this can be seen in kind of a classic example. So let's say somebody had the obsession, what if I touch a door handle and I get some sort of disease or illness? That would be the obsession. And that might result in them compulsively hand washing, bathing as a way of reducing the likelihood of getting sick or developing an illness. And so what happens is they begin to think that they did not get sick because they engaged in the hand washing. But as we know, OCD is very persistent. It's probably, not before long that another obsession comes up where maybe OCD is saying, hey, are you sure you washed your hands long enough? What if you've touched something else since? You might, develop this illness that results in somebody excessively washing again. So it becomes this vicious cycle of the obsession driving up the anxiety, the compulsion temporarily decreasing, that becomes kind of like ups and downs over time. And so this is kind of the vicious cycle that we would typically kind of see with OCD. There are kind of common themes with the obsessions and compulsions. So with obsessions, you can see themes of like aggression, fear that somebody might hurt themselves, they might hurt somebody else, these violent or horrific images, fearful of something bad happening, leaving the stove on, leaving a door unlocked. There can be themes of contamination. That could be a fear or disgust with bodily waste or secretions. It could be a concern with dirt or germs. It can be just like a disgust of coming into contact with those things, but it also can be a fear that it's going to lead to some sort of illness or disease. Other theme areas are like religious obsessions, concerns or thoughts with blasphemy, excessive concern with right or wrong, obsessions around a need for symmetry or exactness. There's also somatic obsessions, worrying that they may be exhibiting symptoms of a specific illness or disease. Some of the common compulsions that you can see are some of those excessive hand washing, grooming practices, counting, excessive checking. And then also a big area is mental rituals or mental compulsions. Some people get confused and look at mental rituals as more of compulsions because they're thoughts. But these are sometimes special words, prayers that somebody says in response to a thought, to kind of reassure themselves, to decrease their anxiety. And that way they're more of a compulsion than an obsession. So that's just kind of a general overview of the presentation for OCD.
One of the things we know about OCD, particularly from clinicians' perspective, because we know most of our population who watch us are clinicians, is there's not enough individuals trained. And one of the barriers is this, in a helping profession like we are, we want people to feel better, we want them to get better, but yet these things you talk about, we want them to do them. We want them to face their fears. What was your experience early on when you began to experiment with EXRP and really making people really uncomfortable at times in great ways? How did you deal with your own internal kind of conflict? Or did you have internal conflict about, hey, I'm making this person not really feel better to make them feel better, which seems paradoxic?
Right. Yeah, I think that that's an excellent point, and I think from my own experience, but I think also through, completing consultations with clinicians, working with OCD, that this is kind of a common topic that's brought up, is kind of a clinician's own kind of discomfort with eliciting kind of that anxiety and distress. And I think naturally as clinicians, like you're saying, we're hoping to kind of decrease kind of their distress. In the long term. And with exposure and response prevention, we're working to decrease their anxiety in the long term, but short term, it does kind of increase that. So I think that's something, just going into it, I think I was aware of and expecting. And I think I also bought a lot into the rationale for it, that I knew that this temporary distress and this anxiety was something that ultimately long-term was going to help this client feel better. And so I think as a therapist, it's important to really believe in why we're doing what we're doing here. And I have to sell, right, that kind of rationale of like, why am I having so much confidence as a clinician and having you do these things that are so distressing? And so I think it's important for me to display that in my sessions with clients who are considering this form of treatment.
Someone who's in the medical field, being a nurse prior, it makes a lot of sense. You give an injection, makes someone have side effects sometimes, or it hurts to get the injection, but it's for greater good. What advice do you have for someone dipping their toes, a therapist looking to get into trying EXRP with their clients? Is there any particular advice you would give them?
Yeah, so I think what was helpful for me is really understanding about exposure and response prevention and its treatment. So one of the textbooks that is an excellent resource that I read before I really began working with these clients was the Treatment That Works, Exposure and Response Prevention for Obsessive Compulsive Disorder. I have it right here, that textbook. Eventually, over time, I ended up completing the 4-day EXRP training that CBI offers. And I think that was an excellent training just for me to kind of better understand and apply EXRP through kind of the expertise and kind of guidance and knowledge that those presenters have. So to me, that would be a starting point. Also, the IOCDF, or International OCD Foundation, has a lot of resources available on its website for clients, for parents, for professionals. So that might also be a good starting point.
And Nicole, you do 2 OCD trainings through our CBI Center for Education. Could you tell us a little bit about, they're going to be upcoming in later this year? Could you tell us a little bit about those?
Yeah, absolutely. So one of the topics that I see come up so much in some of the consultations is differential diagnosis. And I think it can be difficult and challenging for even, the most seasoned kind of clinician to differentiate between OCD and some of its differential diagnosis. So in part 1, we really kind of hone in on defining OCD. What does it look like? And then I spend most of our time differentiating between OCD and some of those diagnoses, generalized anxiety disorder, specific phobia, trichotillomania, excoriation disorder, schizophrenia. So we kind of walk through slide by slide, looking at the similarities and the differences between the two. Also covered in the first part is doing a good risk assessment. As one of the things that I mentioned was that there are aggressive obsessions. And I think as somebody is new in working with OCD, some people get a little bit concerned. Is this client suicidal? Is this client homicidal? Or are these kind of OCD thoughts? And so I spent some time in part 1 working to really differentiate between, is this client actually a risk to themselves or others, or is this more of OCD intrusive kind of thought content? And then in part 2, we take a closer look at the process of assessing for OCD. So we walk through self-report measures for OCD, moving into clinician-administered assessments, then diagnostic-specific assessments, and then additional assessments, assessing for a client's insight level, assessing for family accommodation, and then kind of going through more of the clinical interview. What are the type of questions that you want to ask when you're meeting with a client, and gathering information on their OCD symptoms? So I go through some kind of case presentations in there to apply some kind of real life situations that help kind of really solidify kind of the learning process there.
Great. So I know you've talked about some of the manuals, you've talked about the trainings. What can you give some examples of kind of clients' experiences from the treatment side? What were the benefits to them? How did they experience it from beginning to end?
Yeah. That's another great question. So, I think one of the challenges that I experience as an exposure and response prevention therapist is at the beginning, there's a lot of apprehension about really engaging in this treatment. So, at the start of treatment, I see clients so motivated. They want the end goal, they want their anxiety to be alleviated, but they're really not sure about buying fully into this process of needing to exacerbate their anxiety before it decreases. So at the beginning, I find a lot of apprehension, pre-contemplation, kind of stage of change for most of my clients. And so we talk a lot about what led to them making that phone call to schedule an initial appointment. How has OCD impacted their life in a negative way? What would they be gaining if they had more control over their OCD symptoms? But as clients really begin kind of engaging in the exposures, I definitely see kind of like their confidence level increasing, where they kind of feel confident. Hey, I don't have to engage in this ritual to decrease my anxiety, that my anxiety is not going to last forever, that, I can handle uncertainty, that the feared outcomes are, not likely to happen. And so it's really amazing as a therapist to work with these clients, because I can see from beginning to end kind of the apprehension of kind of beginning it, and then at the end, just kind of like this confidence and like reclaiming their life, as we talk about in this kind of treatment over their OCD symptoms, where they're able to kind of do things that they never were able to do. And so it's pretty amazing.
And Nicole, I just want to add on a more personal note. I myself have OCD, and it was really exacerbated, by the pandemic.
Yeah.
And I really turned into someone who I didn't recognize. And I sought out this treatment, obviously outside of CBI, but by someone who was trained in the EXRP. And while it is uncomfortable, and while it sometimes was not fun, and while I had moments of self-doubt as why am I torturing myself, I can, for one, speak that the work that you do and the work that all clinicians do to treat clients with OCD using EXRP is really, really phenomenal. And I can just speak firsthand as to what an impact it had on my life, and helping me to reclaim my life, I'll say, in certain ways, reclaim that freedom to live, because it is really cruel being trapped in your own head sometimes. So it's really, an amazing treatment model. So I just wanted to kind of personally, share that with our listeners, and then just also say to those clinicians who do this type of work and do this type of treatment, thank you for your diligence to the education of it. I know that it's definitely a complex treatment modality, and it's very effective. So thank you.
Thank you for sharing that. And, I think as a therapist, I always attribute the progress to the clients that I'm working with, because, we're meeting however frequent, once or twice a week. And this treatment is so active and requires so much work outside of the session. And so, I really credit my clients because it is a whole lot of time and effort that they're kind of having to put in to achieve these outcomes. So.
Yeah. And I know that consultation is something that you also work with other clinicians. You provide consultation to clinicians who are treating their own caseload of clients with OCD. So can you talk a little bit about that one-on-one consultation? Because we know that some clinicians who maybe are just starting out with this form of treatment, they may take the 4-day EXRP training. They may not be interested in a full certification through CBI in EXRP, but they do want to start, practicing this type of work with their clients, and they are in need of some individual, supervision on a, somewhat either regular or irregular basis.
Mm-hmm. Yeah. So As Erin just mentioned, so I do offer the individual and group consultation, some of which, as she mentioned, are seeking kind of the certification in EXRP through our Center of Education, and some of which are just trying to have support and kind of guidance through implementing exposure and response prevention for some of the clients that they're serving. So, in my consultation, with clinicians, we just kind of determine what do they need in terms of frequency. So I've met with some people weekly at first, and then we've kind of gradually decrease kind of the frequency of the consultations. So we could meet as frequently or as little as you're interested in. And I really gear those consultations into around what you need, what the consultee needs from that time. And so a lot of times it presents around kind of case presentations, and we talk about different in vivo kind of exposures that could be completed, or, how do you explain the rationale? How do you work on motivation, increasing clients' motivations for this type of treatment? So I like it to kind of be really driven by what that person needs from me in that consultation time.
Wonderful. Well, I know that you are a great resource to the clinicians who work with you both through the certification process through the CBI Center for Ed, and then also the clinicians who utilize you on a more irregular basis, but when they're in need for case consultation for the very complex, care that they're delivering. So thank you so much for all your hard work and devotion to OCD.
Thank you very much. I appreciate you guys having me today.
Absolutely. It was great having you with us, Nicole. And for anyone who is interested on individual consultation with Nicole Gibson, which can be done from anywhere in the United States,
or beyond.
Or beyond. You're right. Not just the United States, anywhere in the world, due to our virtual Zoom format. You can email us at info@cbicenterforeducation.com to get connected with her. And then if anyone is interested in the EXRP 4-day training, we do have an upcoming one in January 2022, which is on our website at www.cbicenterforeducation.com, as well as information regarding the certification program through CBI Center for Education and what that looks like for folks who take the 4-day course. So this was a great conversation. Like I had said, I personally have been affected, and I really appreciate all the work that you do, Nicole and Kevin and everyone who does EXRP. So all of our clinicians out there listening, personally, I also thank you. So this was a great conversation, and we look to further connect with you, Nicole, in the future as you continue to help disseminate, the EXRP for OCD.
Thank you.
And thanks so much to our listeners for joining us this week on the episode of The Barrier Breakdown. We hope that you stay safe and healthy. Take care.
Thank you for listening to The Barrier Breakdown, Disrupting Mental Health. Listeners can find all of our episodes on YouTube, Apple Podcasts, Spotify, and Podbean. For more information and to learn about upcoming continuing education events, check out our website, cbicenterforeducation.com, our Facebook pages, Cognitive Behavior Institute and CBI Center for Education, as well as our Instagram at Cognitive Behavior Institute and our Twitter at CBI_Pittsburgh. Don't forget to like, comment, and subscribe. We hope you'll tune in for another guest next week.